Hello again, class. This is your professor, Daryl Fisher, and now we are moving to chapter 21, the respiratory system. We've talked about blood, which carries oxygen towards your tissues and also carbon dioxide away from your tissues. We've talked about the heart and the blood vessels and how the heart helps pump the blood, and the blood vessels provide sort of the highway for the blood to travel uh, to the tissues. And we've also talked about the lymphatic and immune system in relation uh, to blood. But now we have to, in this chapter, talk about how the oxygen gets to your blood, to the hemoglobin in your blood. Remember, the hemoglobin, uh, the role that iron plays in that hemoglobin and carrying oxygen. And we also have to learn the process by which carbon dioxide is removed from your blood or diffuses out of your blood, probably be the better way to say it. So we have a whole system, the respiratory system, which basically the goal of the respiratory system is to bring oxygen into the body, which gets transferred to your blood, and to remove carbon dioxide from your body. That's the majority of that. That is the overreaching goal. There are more aspects to it that we're going to see. We want that air that we breathe in to be uh, cleaned, as we will see in this chapter. We'll see that that air is warmed and moistened as well through the as it goes from our nose and our mouth into our lungs, and we we will see this close correlation, this close connection with the cardiovascular system as well as with some other body systems that you may uh, not readily be aware of. All right, so let's start with an overview. All right, so the anatomy. So this is anatomy and physiology, so it's important for us to know the anatomy, which we're going to get into more detail of the respiratory system. So we have um, the organs of the system are found in the head, neck, and thoracic cavity. Remember, air enters our nose and our mouth, travels down to our lungs. And that's basically, think of that as the respiratory system. But it's also going to include the blood vessels of the pulmonary circuit, blood bringing, I mean, pulmonary circuit bringing blood to the lungs and away from the lungs. The rib cage is going to play a role. That's going to play a huge role into our ability to be able to breathe. The respiratory muscles. Um, we're going to talk a lot about the diaphragm. We have a right and left lung that we need to discuss, and then we have this respiratory tract, this passageway for the the air that we breathe in and out to travel, which starts with the nose, the nasal cavities, and the mouth. We also have the pharynx, the larynx, the trachea, and then we go into a bronchial tree inside your lungs. Here is a drawing of that diagram of the anatomy of the respiratory system. This is where air enters, nose, nasal cavity, the mouth, uh, goes through the back here. See that this is the tongue here. Some people sometimes get confused. What is this structure? That's actually your tongue. Um, then we go down into the trachea, and then the right and left lung, bronchi, bronchi here, and they split off, and then we have this the diaphragm here. This is if the ribs were open. You see the ribs on the side here, but the ribs we know come around the front. And if you get really close, you get into the bronchioles and the alveoli. right? Upper respiratory tract, lower respiratory tract, right? And we'll talk about those right here. So upper is considered the passageway from the nasal cavity to the larynx, and the lower is the passageway from the trachea to the respiratory tract's terminal structures, the alveoli. Alveoli, those are your air sacs. Uh, they look like a bunch of grapes, and we'll talk about that. But that's where gases gases exchange. So the sort of delineation between the upper and the lower is the larynx, which is right here. So this is your upper respiratory tract, basically air coming in your body. Then you go through the process of it getting warmed and moistened and cleaned, uh, and then it goes down into your lower respiratory tract, past the larynx, and that's where we get into the um, we have gas transfer, which is going to be very important. What are the lungs? They're a pair of spongy organs in the thoracic cavity, enclosed within the rib cage and the diaphragm, and they have millions of alveoli, which those alveoli are connected with blood vessels, right? Connected very closely with blood vessels. And that's where you have the transition, the diffusion of oxygen to the blood and carbon dioxide from the blood, right? Each collection of millions of alveoli and the blood vessels embedded in elastic connective tissue with local branches of the respiratory tract, right? And we're going to talk about those in more detail when we get to that part of that stage in the game, right? So we have uh, this conducting and respiratory zone, two different zones. Tubes of the conducting zone are conduits which air travels. So conduct, when you think of conducting zone, think of basically the air being moved in and out. And as I've alluded to already, that in that conducting zone, air is filtered. We don't want debris. We don't want we don't, we want the minimal amount of particles, debris, germs, any of that getting into our lungs. So that air is filtered. And we'll talk about how that happens. That air is warmed. So that, that air inside is definitely warmer than the air outside, air inside your body I'm talking about. So as air comes into our bodies, it's warmed, and then it's also moistened. And we'll talk about the purpose of that as it travels through the zone. This is the nose, nasal cavity to the bronchioles. Your respiratory zone, this is where gas exchange occurs. Right? Includes only structures that contain the alveoli. So conducting zone is basically air being filtered, warmed, and moistened, basically traveling down to the respiratory zone. Once it gets into the respiratory zone, it's already been filtered, it's already been warmed, already been moistened. Now you just have movement of oxygen from the air you breathe in to the blood, and movement of the carbon dioxide from your blood into your lungs. That's your respiratory zone. So respiration, primary function of the system, as I've said a couple times, providing the body with oxygen and removing carbon dioxide, which is considered a waste product produced by cells. Right? That's why we breathe it out. We breathe out carbon dioxide. We want to breathe in oxygen. Right? This includes four separate processes: pulmonary ventilation, movement of air in and out of the lungs; pulmonary gas exchange, movement of gases between lungs and blood, which is a very huge step; gas transport, movement of gases through the blood. Remember, once that oxygen gets into your blood, then it has to travel through your blood to the cells and then pick up carbon dioxide; and tissue gas exchange, movement of gas between blood and tissues. So these are all, so you have to breathe air in, pulmonary ventilation; exchange that oxygen to the bloodstream, carbon dioxide to the air that'll be is waste that we will breathe out, That oxygen in the blood needs to travel to whatever part of the body it's going to. Remember, every part of the body needs oxygen: brain, your heart, all the tissues, and all the different tissues in your body. And then we have, once it gets to where it's that oxygen is going to be transferred, we have to have tissue gas exchange. So oxygen going from your bloodstream to the tissues, and then carbon dioxide going from the tissues back to your bloodstream. Right. So these are the four separate processes that all have to happen for respiration to happen. There are other functions of the respiratory system, as I also spoke to you about. Speech, what I'm doing right now, being able to talk to you, is a function of the respiratory system. And if you've ever known somebody who had difficulty speaking, you know that that can be uh, that can it can cause some severe challenges in life. That's part of your respiratory system, that ability to be able to speak, along with working with your nervous system. Remember uh, the Wernicke's region in the brain, and those speech is a combination of muscular, respiratory, and nervous. We also have neurons for your sense of smell, your olfactory, uh, being able to smell different things, which is also can play an important role in life. It is possible to expel contents from the abdominal pelvic cavity uh, by increasing pressure in your thoracic cavity. So, uh, unfortunately, not to be too graphic, but if you're trying to do a bowel movement, you may hold your breath, and you can create pressure in your through your respiratory system, which can help you expel something uh, through like a bowel movement, or you know, childbirth. It can increase that pressure in the thoracic cavity. We're going to talk a lot about pressure and how pressure is involved in your ability to be able to breathe in and out. The reason We'll talk about also the reason why it becomes difficult for you to breathe when you uh, go in your higher elevation, because of the differences in pressure. Right? Pressure changes in your thoracic cavity can assist with your venous and your lymph. Uh, this is also the respiratory system also plays a role in your acid-base balance. We're going to talk about a lot about that based on the level of uh, carbon dioxide in your blood, how that can affect your body. And also, we have the synthesis of an enzyme, angiotensin 2, which helps maintain your blood pressure and fluid homeostasis. Let's discuss now the anatomy of the respiratory system. The nose and nasal cavity uh, are considered the entryways into the respiratory system. It obviously, you can breathe through your mouth as well, but we consider the true entry, because your mouth is also used for food, and more so the entry for your digestive system. We consider the nose the entry point for your respiratory system. Okay, so what happens, and you're going to see some similarities between different parts of the respiratory system. Inhaled air is warmed. Uh, your body temperature is 98.6 degrees, roughly. So that air from the outside, temperature outside is usually less than that, between 40 to 80 degrees. So it's once it comes into your body, it's warmed. It's also humidified, um, moisturized, basically. Debris is filtered from your inhaled air. We have nose hairs. And we have other mechanisms we're going to talk about that help filter the air, so that particles, things that you breathe in, dust, doesn't get into your lungs. We don't want that to happen. Um, some antibacterial substances are secreted. So this is going to be um, part of your immune system. Olfactory receptors are housed, a sense of smell, and then we also have enhanced resonance of voice. This is all by your nose and nasal cavity. Um, the external anatomy of the nose, we know it's covered by skin. You can see that. There's muscle bone and there's cartilage. Uh, we don't need to know all the details of the nose, um, but it's superiorly positioned pair of nasal. You have superiorly positioned pair of nasal bones. There's a root. There's a bridge in the nose, uh, which is between the eyebrows and the eyes, respectively. The apex is the tip of the nose, um, and then we have these what we call it, these the entrances are called the anterior nares. This is the general structure of the nose. Everybody has an idea of that. The nasal bones. Um, you have cartilage. A lot of your nose is cartilage. The root, the bridge, the apex, the nares, where the air comes in. Internal anatomy is more what we are concerned with, more so than the outer anatomy. Inhaled air enters the hollow space, your nasal cavity. So inhaled air goes into your nose. You have the nasal septum, which divides your left and right portions. Really quickly, and we haven't talked too much about this, but um, one of the issues with the nasal septum that comes to mind is when someone chooses to inhale drugs through their nose. What they call snorting or inhaling drugs through your nose. It can damage your nasal septum. Any type of inhaled drug, like snorting a drug through your nose is meant to inhale air. It's air. It's not meant to inhale harmful substances. I know we use things like neti pots to sort of clear out congestion um, in in the upper respiratory tract, but and I think that that's fine. But even those things are not necessarily to be used on a regular basis. Uh, they are only as necessary. All right. But that's just something, just a sidebar note that I just wanted to mention. You have the vestibule, the most anterior towards the front region of the nasal cavity. This is where you have the hairs of the nose, which can stop some objects from getting into the nose. Nose hair has a purpose. I know nose hair sticking out of your nose is considered unattractive, but it does have a purpose in that it can stop certain things from getting into the nose. Then we have the superior, inferior, and middle conchae, pairs of bony projections of the ethmoid bone. Um, this area, the nasal conchae, curls around three narrow passages and creates turbulence that also helps rid dust and debris from inspired air. We do not want, and you'll see this over and over, we do not want debris, things that are not good for our body, um, dust, coronavirus, whatever. We don't want any of that stuff getting into our lungs. So your body does has a lot of parts in place that are responsible for preventing that from happening. And then we have our paranasal sinuses, hollow sin. When you think of sinus, just think of like an opening, a hollow cavity, and this is formed with the frontal ethmoid and the sphenoid and maxillary bones. And as you see here, as we mentioned before, that's where we have the warming, the humidifying, the enhancing of the voice, and also sinuses because they are gaps. Your head is not a solid structure. It's not like a rock where it's solid all the way through. The sinuses create spaces in the skull. Therefore, the skull is lighter than it would be if it were completely solid, which allows you to be able to hold your head up and watch this video. All right, so these are the structures. If you look at it from a CT scan, right? Structures inside the nose and nasal cavity. We're also going to see some um, similarities when we look at the histology. The vestibule is lined with stratified, that means multiple layers of squamous flat epithelial tissue. So this is designed to resist mechanical stress. So you have air coming in at a quick rate, and it's designed to resist mechanical stress. Posterior to the vestibule, as you go further back, you have a change in your epithelium, and you have two types of mucous membranes: olfactory mucosa and respiratory mucosa. Right, the olfactory mucosa houses your receptors of smell. It's the roof of the nasal cavity. So we notice so right here your olfactory mucosa, and then we also have the rest of the nasal cavity is lined with the mucosa composed of pseudostratified, ciliated, and this is important. You're going to see this often: pseudostratified, ciliated columnar epithelium and goblet cells. Right? Pseudostratified. It looks like it's stratified, but it's actually not. Um, the nucleus are arranged so that it looks like it's more than one level, but it's not. Ciliated, that means it has cilia protruding from it. Think of nasal hairs. When you think of cilia, we want to um, sort of like little hairs that protrude from it. Columnar, column shaped. The shape of the cells are columnar epithelium, so it's on the surface. And we have goblet cells, which secrete mucus, right? So olfactory mucosa in the roof of your nasal cavity, and those are just house the receptors for smell. And then we have the respiratory mucosa, which is made up of pseudostratified ciliated columnar epithelium. And it is important for, as we mentioned earlier, warming and humidifying the air. And also, we're going to see a cleaning ability here as well. So it's a combination of ciliated epithelium and mucus. Mucus is specialized for air filtration, removing foreign particles that we breathe in. Remember, anything can be floating around in the air that you breathe in. That's why right now many people are walking around with a mask on due to the coronavirus, but it also prevents dust and other things from getting into your body as well. So it's good for that purpose. But your own body has your nasal hairs has this pseudostratified ciliated columnar epithelium and mucus, which can also help trap things that you breathe in so that it doesn't get into the rest of your body. And the ciliated cells propel debris and mucus toward posterior nasal cavity and your pharynx. Okay, so we can trap things that we breathe in and then propel it away into our nasal cavity and our pharynx. Your pharynx is what is known commonly as your throat, which is the next segment of the respiratory tract. So air comes in your nasal cavity, your nares into your nasal cavity, and then it goes into your throat into your pharynx, which is divided into three different divisions: the nasopharynx, the part closest to your nasal cavity, and that is lined with, again, pseudostratified ciliated columnar epithelium, with the purposes again for warming, humidifying, and filtering the inspired air. Right? Extends from posterior nares, so from the end of your nares to your uvula, which is in the back of your throat. Your uvula, right? That's your nasopharynx. The uvula uh, is a soft palate, and soft palate move posteriorly during swallowing. And there's a neat video on this if you look at YouTube. Um, just look up uh, you look up uvula and swallowing on YouTube, and there's some cool videos that show how things are swallowed and how when we swallow, uh, how your body prevents food from going into your trachea and going down the, the right pathway, the esophagus into the stomach, right? You have the oropharynx. It's the next segment, extends from the uvula to the tip of the larynx, the epiglottis. This is now we changed the structure a little bit. This is lined with non-keratinized. Non-keratinized doesn't have keratin, meaning it's not. Remember, when we have keratin, for instance, in our skin, in the cells in the epidermis, those cells become keratinized. They eventually die, and but provide a good barrier. Basically, these are non-keratinized, stratified squamous epithelium. Notice the ciliated part has been taken out, uh, but they are more protective against mechanical stress, as this cavity uh, is a passageway for both air and food. So this short section uh, is you can have food and air passing through this area. Remember, we can breathe in through our mouths, but we can also eat in our mouths, eat food through our mouths, as we all know. But that if we breathe in through our mouths, we want that oxygen to go into our trachea and eventually into our lungs. If we eat through our mouths, we want that food, it'll go into through the oral pharynx, but we want it to eventually go into the esophagus and to our stomachs. Think about that. So that's something that is important. That it's important that we be able to do both through our mouths at times, even though it's recommended that you breathe through your nose because your nose has more things to filter the air and to protect your body. That's why they say when you're exercising, um, and you're focusing on your breathing, they say to breathe in the nose and breathe out of the mouth. Breathe in the nose because it cleans the air, and breathe out of the mouth because you can get more air out faster through the mouth. So, if any of you are, it's difficult to do. It's not easy to do, but if you're next time you find yourself on a treadmill or doing some kettlebell swings or some low plank, try to do that. Try to breathe in the nose and breathe out of the mouth. I also find that when you breathe in the nose and out of the mouth, it helps. It's like a sort of a calming effect on the body. You don't pant as much, and so you seem to. It almost seems like you get more oxygen that way. But we'll talk about that. After the oral pharynx, you have the laryngopharynx, which is the last segment, which extends to the hyphoid bone in the the hyph extends from the hyphoid bone to the esophagus, which is the tube that connects to the oral cavity to the stomach. Anteriorly opens into the larynx, the voice box, which we're going to talk about that and the ability to enunciate words, and posterior opens into the esophagus. All right, so this is also a common passageway for both air and food. So you'll find that similar histology to the oropharynx, non-keratinized stratified squamous epithelium. All right, so look at this structure closely, and we see the nares, the nasal cavities, uh, the nasopharynx, which is at the posterior region of the nasal cavities. All right, so we're still sort of above the mouth. Oropharynx, this is where food can come food can come in. You could have and um, food and air passing through non-keratinized. Um, where did my thing go? Non-keratinized epithelial, and then you have the the larynx, and the laryngopharynx uh, is the region here. And notice here you have where you could go into the space behind uh, the the space behind the trachea, the esophagus, which probably should be drawn a little bit better in this picture because it looks like it closes and it's not closed, it's open. And then you have the space you have anterior to the esophagus here is you have the trachea, okay? The trachea where our oxygen and carbon dioxide are passing, right? So there's that there. And then we have these uh, you have your vocal cords right there and the epiglottis, which is going to be sort of like the passageway. So uh, I think I have a slide coming up, but um, really quickly. So what is choking when we uh, well, like when you say something went down the wrong tube? What is that? It's and we're going to talk about the process of swallowing in a little more detail, but basically is some for instance, if I drank some water and tried to talk at the same time, if I tried to do them both at the same time and didn't pause for a second, that water, if that water got into my esophagus, got past my epiglottis and into my esophagus, I would have that sensation of I want to cough it back up because and used air to push it out, push it back up because it would be that's what we would call going down the wrong pipe, so to speak. Okay, hopefully that makes sense. Now we get into the to the larynx, the voice box, next anatomical region. That inspired air enters, keeps food and liquids out of remaining respiratory tract, and also houses your vocal cords. Right, so we saw that in this diagram here, the larynx, which is our epiglottis and our vocal cords right there, but it keeps food from entering our trachea. That's going to be very important. Short, it's a short tube anterior to the esophagus, in front of the esophagus. Vocal cords create superior and inferior boundary where two different types of epithelium are found. You have this stratified squamous. So again, stratified, multiple layers, means it's built to sort of resist against stress, protection. Non-keratinized, non-keratinized epithelium protects larynx from mechanical stress. Here, the vocal cords where both food and air pass through. So on the outside of the larynx, you have food and air both passing by. But once you get into the trachea, then now we only which is once you get basically once you cross through the gate that is the larynx, you have pseudostratified ciliated. Notice that again. Now we're back to ciliated columnar epithelium inferior to the vocal cords below. Uh, Cilia serve to propel mucus and debris up and out of larynx as one clears their throats. This is what I talked about with the coughing. So in this case, um, cilia can propel mucus and debris up and uh, out of your throat, which is really is what we call the trachea, is what we're talking about. All right, your trachea, that's your windpipe, right? The next structure uh, that inspired air flows through on its way to the lower respiratory tract, your trachea, right? Now we've gotten so in the nose, we inhale air, warmed, purified, warmed, filtered, uh, humidified. It comes down into our pharynx, and then we get into we get into a region where you can have air or food, and then the food is going to go into our esophagus and go to our stomach, and we'll talk about that in the digestive system. But air is only once we get to the trachea, now we can only have air. All right, there will only be air, oxygen, nitrogen, carbon dioxide. Remember, we breathe the air that we breathe in is not just oxygen. All right. So by this time, we're headed to the lungs. We're on our way to the lungs. So trachea is our windpipe. Begins in an inferior neck and extends to the mediastinum. Right. That's your trachea. All right. So now we're on our way to the lungs. This is a neat picture here. You can see the trachea here. And this is um, a transverse cut, like through the neck, so to speak. You can see the lumen of the trachea, and you could see behind it the esophagus, right? So this esophagus goes to the stomach, trachea goes to the lungs, right? We breathe a lot more than we eat. Air needs to get in and out quickly. Notice the size of the trachea and the esophagus. All right, so this is going to be another important factor. Hyaline cartilage rings cover anterior and lateral surfaces of the trachea in a C shape, right? Look at this cartilage, cartilaginous ring, hyaline cartilage. Notice this shape right here. This is what they're talking about. This blue right here. That's a C shape. Okay. Oh, oops. Leaving posterior surface uncovered. See this smooth muscle. This portion is uncovered. Rings are supportive enough to keep trachea open. So your voice, we want that to stay open, um, yet flexible enough to allow trachea to change during ventilation, pulmonary ventilation, breathing in and out. Okay, so uh, that's going to be important. Uh, Also, posterior surface of trachea is covered with elastic connective tissue and smooth muscle. Here, allows esophagus to expand during swallowing. So when you're swallowing something, your esophagus actually can expand in order to be able to allow you to swallow that, that cheesesteak that you're eating, right? The carina, the last tracheal cartilage ring. So this is the base of our trachea, forms a, a hook that curves down and back to form partial rings that surround first branches of your bronchial tree. So now we're about to get into the bronchial tree, eventually to the bronchioles, and eventually to the alveoli. So now we're getting into the lungs. The carina's mucosa contains sensory receptors that trigger violent cough reflex if foreign materials contact them. So if something were to get to this point, so if you breathe in, it doesn't get caught in your nose hair, it doesn't get caught in your ciliated um, your pseudo stratified uh, ciliated epithelial with the mucosa, the mucus around it. If it doesn't get caught there, if it doesn't pass uh, into the esophagus and go into your stomach, if it still gets into your trachea and it gets down to your carina, that's when you get that cough. At that point, violent cough reflex. Right. So at that point, your body will violently react to try to remove something, debris that gets into that point. Um, the mucosa of the trachea is also pseudostratified ciliated squamous epithelium and goblet cells. Okay, so still trying to protect, to filter any type of debris that may be entering your body. And this is what I was just alluding to, smoker's cough. Uh, eh, Cough really develops. Um, I mean, there's a lot of chemicals. We know there's a lot of chemicals in smoke. I do not recommend smoking. If you haven't already gotten that from my numerous references to uh, healthy living and healthy eating and exercising, I do not recommend any type of smoking, marijuana, tobacco, um, dust, any of that kind of stuff. Do not, please do not put that in your bodies. But I understand that people absolutely do. But hopefully, at the end of this class, if you're ever considering, you won't. But just the important point that I wanted you to pick up here is that smokers cough actually the you kill with smoking, you kill the cilia. Remember these cells are pseudostratified, ciliated cells, and so you kill the cilia, the cilia, and then what happens is the mucus, the cilia is necessary to move the mucus once the mucus traps debris that you breathe in. So now that cilia is dead, so you can't move that mucus, so that mucus gets sort of stuck. And remember, if anything gets down to your carina or anything gets stuck in your trachea, you're going to want to, your body tries to cough it out, just like I was talking about with the water. If I drink water and it went down the wrong pipe per se, and so you develop this violent cough, that smoker's cough, that that deep cough. So you don't want that. It's not sexy. Right now we get into the bronchial tree. Um, so once inhaled air reaches the carina, now it can enter your left or your right primary bronchus. And so uh, I don't know if I mentioned this earlier, but we have a left and a right lung. And they are a little bit different from each other. We're going to talk about that when we go into more detail about the lungs. But when we breathe in the nose or breathe in the mouth, um, and all the way through the nose, the pharynx, the larynx, um, the trachea, you're basically, that air could go either to the left or to the right. It's once we get past the carina, the end of the trachea, now air goes now that air is split, and some of that air goes to the left and some of that air goes to the right lung. And one thing that I like to think about is that my wife works in the hospital, and they actually have the ability to do lung transplants, which I just I just find absolutely amazing. I don't know exactly how it's done. I just was thinking, like, I was just, while I'm sitting here thinking about it, but once as we get into more details, you'll see that there is really no way for us to duplicate what the lungs can do. We can't, as far as I know, we we uh, we really can't duplicate it. It's The lungs are so very important, and they are very intricate with the we're going to see with the bronchi and the bronchioles and the blood vessels that it's a very intricate design. And if something does go wrong with your lungs, as you probably already well know, there's such things as lung cancer or emphysema, issues with your breathing and everything like that. When these things do go wrong, it can be very problematic. But able to um, to be able to transplant something like this, I think is just simply amazing. All right, let's continue. So now we've gotten the air all the way into the body. We've gotten to the carina. Now it's going to the left or to the right, uh, um, which is the primary bronchus. And you'll see the bronchus, bronchi, bronchiole. You'll see that term. You've probably heard of bronchitis. Um, we'll talk about that as well. Once inside the lungs, each bronchus branches into a bronchial tree, a series of progressively smaller tubes that end in the alveoli. So you notice in the right lung, we have right primary bronchus, which is this structure here, right secondary bronchi, right tertiary bronchi. And then in the left, we have the left primary bronchus is here coming from the carina. And then we have secondary and tertiary. And you'll see this little notch here. You've probably already seen this if you've done the lab assignment. This little notch here, this is where the heart is. So space is given in that left lung for the heart. Right, your right primary, your primary bronchi, beginning of the bronchial tree, divided into left and right branches. Right primary bronchus is a little bit wider, shorter, and straighter than the left, which is narrower, longer, and more horizontal. Differences are due to the position of the heart. So the heart causes a little bit different shape of the bronchi, the bronchus in each, uh, in the right and left lungs. right is more likely side of inhaling foreign objects because of these anatomical differences, because the right's a little bit bigger. If you do have something, if you do inhale something that is not good for your body and it gets past your carina, it's more likely to go into the right lung than the left lung, just because that passageway to the right lung is a little bit bigger. Um, once we get once we get past the primary bronchi, we branch into the secondary bronchi, three on the right and two on the left. So primary bronchus is here. Then we have the secondary, right secondary, left secondary. So you have three secondary on the right, two secondary on the left. Again, because of the heart, this is a picture of your secondary bronchi. The secondary bronchi branches branch into 10 smaller tertiary bronchi. So it just keeps branching smaller and smaller. Sort of similar to when we talk about the circulatory system, and we start off with the aorta, and then we um, get smaller and smaller and smaller until we get to the capillaries. Similar sort of structure here in the lungs. All right, and notice this looks like a sort of like a tree, like branches of a tree. That's where we get this term bronchial tree. As airways divide and get smaller, histology changes significantly. All right, so your primary bronchi are very similar to the trachea, uh, but three changes are evident as it becomes smaller. So what happens as we go from the trachea, big tube, bronchus, very similar to the trachea, good sized tube, to the secondary and tertiary bronchi, right? So cartilage changes from C shape, remember that C shape around the trachea, to complete rings. You have changes also in the epithelium, which gradually changes from respiratory and the larger bronchi to columnar cells in the smaller bronchi. We're going to talk about the purposes of that. And the amount of smooth muscle increases, which is interesting, as your hyaline cartilage decreases, as the bronchi get smaller and smaller. Um, these smaller airways need to be able to sort of change your shape, change your diameter, similar, somewhat similar to how blood flow. You need to have a little bit of flexibility. They can control airflow in the bronchioles and the alveoli. All right, bronchioles are the smallest airwaves. Right, that's going to be that's going to be basically the last step before we get to the alveoli. We get to these bronchioles, these smaller airways, uh, and their features differ a little bit as well. They have simple cuboidal. Remember, we were talking about pseudo stratified columnar ciliated before. Now we have simple cuboidal. Simple meaning one layer, cuboidal epithelium with few cilia, if any, thick ring of smooth muscle, and no hyaline cartilage at this point. So it's not a structure that is rigid. Uh, and then you have this conducting zone of respiratory tract ending when inspired air reaches your terminal bronchioles. So one of the questions in the lab was talking about what is the delineation between the conducting zone and the, the respiratory zone, and the end is the terminal bronchioles. Terminal bronchioles, because at that point, then we get to the alveoli. Okay, terminal bronchioles, which is here, terminal bronchioles, and now we get to uh, the alveoli. The terminal bronchioles branch into smaller respiratory bronchioles. See these little structures. It's a terminal bronchiole, then you have these like sort of tree with like looks like grapes with eggs on it. Respiratory bronchioles. That begins your respiratory zone, and then on the ends of those you have the alveoli here. Your respiratory bronchial branches and these alveolar ducts also have alveoli attached to their walls. The alveolar ducts end in these alveolar sacs, grape-like clusters of alveoli, and that's where your gas exchange. And this is an open. If you cut it open, this is what it will look like. And that's where your gas exchange happens. So terminal bronchial, we end the conducting zone. Then we go into the res, respiratory bronchial, which leads to the alveolar ducts, which leads directly to the alveoli, which are the air sacs, which is where we have oxygen and carbon dioxide exchanging. All right, so this is the structure. Nair, we breathe in, nasal cavity, filter the air, start to warm it, nasal pharynx, continue to warm and filter the air, oral pharynx. That's where we have food and air, laryngopharynx, also have food and air. The larynx cuts off any kind of food or liquid, and we have opening to the trachea. Trachea takes um, inspired air down to our bronchi, primary bronchus or primary bronchi, goes into left and right. Lungs, secondary bronchi, further splits. Tertiary bronchi splits even smaller. Multiple branches of bronchi, bronchioles, even our smallest structure, which terminate in our terminal bronchioles. This is the end of our conducting zone. Now we get into our respiratory zone, where we have respiratory bronchioles, which lead into alveolar ducts, which have sacs of alveoli, which are known as alveolar sacs, and that's where we have transfer of oxygen and carbon dioxide. All right, so the alveoli are your final destination for your inspired air. Thin-walled uh, alveolus has three cell types. We have squamous cells, type 1 alveolar cells. We have our squamous cells, account for about 90% of the cells in the alveolar wall. Very thin, squamous means flat, very thin, because we want that transfer of oxygen and carbon dioxide across that surface to be quick, right? That's the whole point. That's the whole purpose, really the main purpose of the respiratory system. All right, so these type 1 cells are one of three components of the respiratory membrane, which is the barrier through which these gases must diffuse. Right? See, these respiratory membranes formed by the fusion of simple squamous cells of the alveolus and the endothelial cells of the pulmonary capillary. So you have the alveoli, and the cells of that structure, that wall, and then right next to it you have the capillary, and you want the oxygen to be able to go in from the alveoli to the capillary and the carbon dioxide to come back through. All right, so you want that to happen as quickly as possible. So you need that to be very thin and much space for that to happen. So as you'll see this, they're the circular shape, so they have a huge surface area. All right, so this is what it looks like. It's a nice little diagram here. This is known as the respiratory membrane, the the structure between the inside of the alveoli, the alveolus, and the inside of the capillary, the blood capillary. So, you have the surface of the capillary. You have uh, basal lamina here. So endothelial cells of the capillary, surface of the capillary, basal lamina, and then you also have a type 1 alveolar cell here, which is a squamous cell here. We're also going to have type 2 alveolar cells, which small cuboidal cells that are just 10% of that cells, which synthesize surfactant. That's going to help increase reduce the surface tension on the alveoli. And we're going to talk about that, keeps them inflated. And then we also have alveolar macrophages. Remember macrophages? We talked about that in chapter 20 when we talked about the lymphatic and immune system. These are mobile phagocytes derived from bone marrow, which can clean up and digest debris. So if anything does get into uh, the alveoli that's not supposed to be there, it can be cleaned up by these macrophages. All right. Uh, so your right and left lungs are separated by the heart and mediastinum, and there's a little bit different structure between the right and the left. But in general, the lungs rest on your diaphragm. It's going to be important for you to breathe. They're connected to the inside of your rib cage. We're going to talk about. They go all the way up to your clavicle. That's the apex of the lungs, just below the clavicle, right? And then we have this structure called the hilum. Don't get it confused with helium, but the hilum, which is a slight depression on each lung, basically. So that's where your bronchi, your blood and lymphatic vessels and nerves enter and exit the lung, right? So if we were to replace your lung, we would have to reconnect. If you get a lung transplant, I'm assuming you would have to like reconnect right around there. And then we have this cardiac notch, which only in the left lung, that sort of gap in the lung, that space where it makes room for the heart. Each lung is going to be divided into lobes. The right lung has 3 lobes. The left lung has 2 lobes. Remember, because the heart's there, so it's a little bit smaller. Right lung, you have superior, middle, and inferior lobes. Left lung, you have just a superior and inferior. The lobes are in the right lung are you can see the difference in the lobes. They're divided by the horizontal fissures, and the left lung by the oblique fissures. And then it gets smaller and smaller. But the the reason why the lobes are important is because the secondary bronchus supply air, oxygen, and remove carbon dioxide. There's a secondary bronchus for each lobe. Okay, and then it further breaks down into the segmental bronchi, and then eventually into the lobules. So it gets smaller and smaller and smaller regions. This is the general structure. You see the clavicle, apex of the lungs, diaphragm, base of the lungs, the cardial notch, 3 lobes of the left, 2 lobes of the right, lobes divided by the horizontal fissure. These lobes divided by left oblique flit. The 2 lobes of the left divided by the left oblique fissure. The helium, I mean, I said helium. The hilum, where we have our pulmonary vein, pulmonary artery, um, and our bronchus and our lymphatic vessels go into the lungs. Each lung is found within the pleural cavity. That's the cavity we call where the lungs are, which is a division of the thoracic cavity, located between 2 layers of serous membrane. You have the parietal pleura, outer layer of the serous membrane fused to the rib cage, diaphragm, and other local structures, and that's going to be very important. That helps our lungs stay connected to the rib cage and diaphragm, which allows it to be expanded so that we can breathe in and out. At the hilum, parietal pleura turns over on itself to create the visceral pleura, inner layer of membrane continuous with the surface of the lungs, which dives into the fissures between the lobes. Pleural membranes secrete a thin layer of serous fluid, pleural, pleural fluid, uh, that fills space between the layers and serves to lubricate delicate surfaces of the lungs, which is important during ventilation, which we're going to talk about. And that's the basic structure there of the lungs. Looking at a transverse cut, you see the pleural cavity, the parietal pleura, and the visceral pleura right on the surface of the lungs. You see the heart there, vertebrae there. All right, and this is just a chart. You can sort of look through all the anatomy of the respiratory system.